Hi, everybody. My name is Natalie Yeadon, and I'm the CEO and co-founder of Impetus Digital. At Impetus Digital, we built some of the best-in-class asynchronous and synchronous virtual collaboration and communication tools. We work with life science companies from across the globe over the last 13 years to help them do things like virtual advisory boards, steering committees, publication groups, medical education, protocol changes. And even since we've launched our big Insight events platform, we've been helping people with medical conferences, big sales, and MSL training. But more importantly, at Impetus, we really believe that everything starts with a conversation. And from these big, hairy, audacious conversations with leading edge thinkers, provocateurs, technology entrepreneurs, we can all work to collectively and positively disrupt healthcare. But we feel that you can't just start the conversation, you need to sustain it. And this is precisely the reason why we have our Insights Touchpoint platform. So we can have a series of asynchronous and synchronous touch points over time so that we can work with payers, patients, allied healthcare providers, physicians, to work as interested stakeholders to move the needle on new agenda items, new strategies, new ways of really putting a dent in the healthcare system, everything from market access to clinical trials. So I'm really happy to have one of these leading edge thinkers at the table with me today. And this is actually Laurence Girard. He's actually the CEO of a company called Fruit Street Health. They deliver the CDC's diabetes prevention program. And they do this to commercial health plans and employers via a group telehealth video conferencing and with registered dietitians. They also use wearable devices such as Fitbit, as well as wireless scales, food scales. And they also use a mobile application that allows participants to actually take photos of their food and receive feedback. Fruit Street Health has raised over 25 million with zero from venture capitalists. They're going to want to talk a little bit about how they actually did that. But they have actually done this through a physician network of investors. So this is kind of this new concept here, and a whole series of other medical professionals who are really passionate about changing healthcare. So Laurence is also building a new mobile app and a website, which we're going to want to dig into today, called COVID.md. This is actually being built to provide education and telemedicine services for COVID-19 to the public. So Laurence's primary passion is using telemedicine and entrepreneurship to have a social impact on public health, and he is one of the leading voices in the US on the future of telemedicine and health technology. Welcome, Laurence. It is such a pleasure to have you on the show.
Thank you for that introduction. I really appreciate that, and thanks for having me.
Absolutely. So thrilling stuff. I love how socially minded you are. I love the fact that you raised 25 million without the typical way of going through seed investing and your B and C series and all these other things, and that you did this a completely different way. Tell us how you landed in the entrepreneurial world and what got you started with your business, with what you're doing right now with Fruit Street Health.
Sure. So when I was younger in high school, I actually wanted to play professional soccer. And so I played for the New York Red Bulls academy team when I was 18. And that's where my interest in diet and exercise started. But eventually I decided that I wanted to focus on something with a larger social impact and go to medical school. And so the year after I graduated from high school, I was volunteering in my local emergency room while simultaneously taking a nutrition epidemiology course with a Harvard School public health professor. And I quickly realized that almost no one does those two things at the same time because they're just polar opposites. And I realized that a lot of the patients that come into the emergency room with diabetes, heart disease, stroke, obesity, that so much of it is preventable through diet and lifestyle. And then I got interested in telemedicine because I was volunteering for an education nonprofit that provided free online tutoring through video conferencing for K through 12 students. But eventually I moved to Boston and I was in the bachelor's degree program at the Harvard Extension School, which is the division of continuing education. A lot of traditional age college students pursue it. And now I'm taking some executive education courses through Harvard Business School. But while I was there, Harvard opened the Harvard Innovation Lab on the business school campus, which is an entrepreneurship center where serial entrepreneurs come in and teach and mentor the students. And I just became interested in using technology and entrepreneurship to have a larger scale impact in public health, and met some physicians at the innovation lab that worked at Massachusetts General Hospital, and they decided to invest in the company. So it all started as a summer project at the innovation lab, and now I've been working on it for more than 7 years.
Wonderful. What a great inception and creative way of getting it started. So when the idea first was conceived by you, how have you seen the idea evolve? Did you have to pivot at all? And I'm just curious as well, with the fact that you invested in telemedicine 7 years ago, suddenly we get hit with COVID-19 and the pandemic. How has that changed what we see with your business today?
Yeah, so there's been a lot of pivots over the years. Initially, the business was more focused on providing telemedicine software to dietitians and doctors to use in their physical brick and mortar practice. So it was a software as a service business model where we would get paid $200 per month by these dietitians and doctors to use the software. And today that software is actually being used at Harvard Medical School. The CDC has used it. But eventually we realized that after 4 years of building that software, we had built a great software product and dietitians were using it to help people improve their health. But we realized we had the wrong business model. And we realized that instead of selling software to dietitians, we should actually be selling telemedicine services to self-insured employers and health plans, and actually employing the dietitians to deliver these services. And that pivot was made in 2018, which is really when our revenue started tripling and quadrupling on an annual basis, because we were now aligning with payers, and the payers were covering these services at 100%, so that there was actually no cost to the individual patient or participant. And so that was the biggest pivot we made that's really set the company up for success, but there's certainly been other ones along the way.
Oh, absolutely. And we're going to dig into those a little bit. So so you mentioned that you did that big pivot in 2018. And so you went almost from some ways a bit of a subscription model or a SaaS model to a managed services model. Did anybody ever sort of speak about how the fact that was kind of reverse of what typically companies will do? And how did you kind of manage some of the dialogue around, well, you're moving from recurring revenues to reoccurring revenues, and how stable is that and what have you? So how do you kind of counter the the sort of the trends, if you will, and how typically companies are being socialized to behave and to function?
I think in healthcare, it's just a different industry, right? I mean, if you want to align with payers, at the end of the day, you have to deliver healthcare services, because that's what payers pay for, right? They don't pay necessarily for, it's harder to convince them to get them to pay for a software-based product. And then if you look at all of the successful telemedicine companies, Teladoc, MD Live, Doctor on Demand, Livongo, American Well, they all have the same business model, which is that they sell to self-insured employers and health plans. And so there's no need to reinvent the wheel. I think if you look at almost, the majority of digital health companies, they're selling to self-insured employers and health plans. If you want to really align with payers, you have to think about, well, how do I improve outcomes? How do I reduce costs, improve the patient's experience, improve the clinician's experience? And I think part of it's just that human connection. The reason why our program is so successful is that people build a close relationship with their registered dietitian or their healthcare provider. And so I think that it's just the most important thing for a healthcare business, I think, is aligning with payers, because if it doesn't get reimbursed, it's going to be very difficult to scale.
Absolutely, 100%. So let's actually talk about the Fruit Street Health methodology. Let's actually just talk about it from the customer perspective. How do people get introduced to Fruit Street Health? You're selling to the payers, you're selling, to the providers. So who is introducing the app, the concept to the patient? So tell us a little bit about what the customer journey is with your company.
Yeah, so our most successful product has been our diabetes prevention program. And so typically the payer, whether it's a Blue Cross Blue Shield plan or an employer, will do some sort of communication, for example, through email that says there's a new weight loss and diabetes prevention program. Come take a 1-minute risk quiz to see if you're at risk for prediabetes. And so the CDC has developed a 1-minute quiz that people can take to see if they're likely to be pre-diabetic. Actually, 1 out of 3 Americans are now pre-diabetic. So if they take that quiz and they get a high risk result, typically they would be eligible to enroll. And then we would ask them, do you prefer to do a class with a dietitian on a weekend or a weekday? Do you prefer morning, afternoon, or night? And they join a class. And the structure of the program is that it's 12 months long. It's one dietitian and 30 participants in a group, video conferencing 26 times in a year for an hour on Zoom, covering topics like diet, exercise, sleep, stress management. We also issue them a wireless scale so they can track their weight loss progress, their physical activity through a Fitbit, and then they can take pictures of their food in our mobile application. They can also do things like text message with the dietitian throughout the week. And the goal is really to get them to 5% weight loss. Medicare had funded actually a huge clinical trial where they proved that the in-person version of the program helped people reduce their risk for type 2 diabetes by 58%. And all we're doing here is delivering that in a more convenient digital format through the convenience of Zoom, which we've all become so accustomed to because of the pandemic. So,
Absolutely.
but that's the experience, yeah.
So did you find that there was an increased interest, participation rate, engagement rate since the pandemic? Tell us a little bit about how this, this tragedy that, we've all just trying to emerge out of has impacted your business one way or the other.
This has definitely been our biggest year of revenue growth. I think as it relates to the diabetes prevention program in particular, people have had a very difficult time maintaining their weight, eating properly because everybody's been so stressed, exercising. And so we've even had our dietitians give advice specifically during the pandemic, since people's lifestyles have changed so dramatically. And people with diabetes and metabolic syndrome have had the highest mortality rates for COVID as well. And so I think that, we have had thousands of participants enrolling per month over the last 6 months, and even earlier than that. So it's been our biggest year of growth to date, but we've just seen that people have had such a hard time maintaining their weight. Some people are calling it the pandemic pounds. I think most people I know gained some weight during the pandemic, and now people are trying to lose it, right? But aside from diabetes prevention, I think we've just seen thousands of healthcare providers, millions of patients using telemedicine for the first time, where maybe they were skeptical in the past, and now they are fully bought into it, where they think this is the future of healthcare. And you're seeing that at a legislative level as well. And so I think that telemedicine is here to stay, but now that cultural shift has happened.
Yeah, phenomenal. Sounds like a really amazing program, and there's a lot of legs to it. So kind of want to tease it apart. So really interesting about how people find out about it. They get in, and I think people love quizzes. They love assessments. They love to see where they are. So it's a really interesting segue. So I'm just curious, if they're going to a government site to do this, to do the assessment, how does it trigger, or how is there any interoperability with your app or your system or the download? What is kind of that next step in the trajectory of the patient journey?
Yeah, so you can take it on the government's website, like cdc.gov, but actually the CDC encourages digital health companies like Fruit Street to just embed it in their own application.
Right.
So it's fully embedded in our application. And when they take that quiz, they get either a high risk result or a low risk result, or in some cases they're not eligible. For example, the program's not designed for people that are pregnant, for example, or under the age of 18. But if they get a high risk result, it would explain to them, you are likely to have prediabetes, and then they can actually enter their health plan ID number into the application, and we can run a real-time eligibility check with the health plan through our partner, Change Healthcare, because we want to make sure that we have all of the correct insurance information as they go through the program, because the way that we bill for the program is that it's based on milestones. So we get a payment when the employee signs up, another one after 2 classes with the dietitian, 6 classes with the dietitian, and then 5% weight loss. So what we're actually doing at each milestone is using the diagnosis code for prediabetes and the CPT code for online diabetes prevention. And the employers and health plans love this because it's all performance-based. We don't get paid anything unless there's some sort of engagement or outcomes. And it's all going through as a claim. Typically, wellness programs are sitting in some other budget category, but we're billing for these services the same way that a doctor is. But basically, people take the quiz, they enter their insurance information, they join a class, and then they would start participating on a weekly basis. So in the beginning of the program, there's weekly classes. It might be every Saturday at 2 p.m., for example. that they're joining these classes on Zoom. And then throughout the week, they're stepping on their scale, they're using their Fitbit, they're taking pictures of their food, they're text messaging with their dietitian throughout the week. And that's pretty much how the experience is.
Wow, it is really, I love it. It seems so seamless and so super easy. What is the engagement rate? After people have taken the quiz, which is embedded in your site, and they find out that they're pre-diabetic, what is the percentage of people that do enroll in your program?
Yeah, so the types of statistics that we could share include things like if you were to look at the number of people, or if you were to look at the subset of people that attend one class and they enrolled a year ago, you would see 1 out of 3 people losing 5% of their weight. If you look at the group of people that have good adherence, which is attending 60% of the classes, you would see 48% losing 5% of their weight. We've also had other people lose 10 and even 15% of their weight before. One of the ways our outcomes are tracked is that we have to report our outcomes data to the CDC every 6 months, and they actually grade diabetes prevention programs. So we have what's called full recognition. It means you're consistently delivering certain results like 5% average weight loss. There's certain attendance requirements. And so payers look at the CDC recognition status to decide if they want to pay for this program. Often, I mean, we consider everybody that completes the quiz to basically have enrolled at that point. I mean, they're basically creating an account at that point. But you might have you might have even as much as 30 to 50% of drop off depending on the population. I guess to answer your question more precisely, because sometimes people take the quiz and they get the result that they're pre-diabetic, but not everybody's ready to change their lifestyle.
Right.
So they do have to actually go to the next step. So I mean, I guess I misspoke slightly. My point is that there are people that take the quiz and they don't enroll because they're not ready to change their lifestyle. But we have now enrolled more than 20,000 people. We've been enrolling between 2,000 and 3,000 people per month. What we find is that the hardest part of all of this is getting people to enroll, because when they enroll, they have good outcomes. But it's like, how do you get these people to take the first step in changing their lifestyle?
Yeah, it's a huge thing. One thing I do want to say that was really interesting what you stated, Laurence, is that the setup that you have in terms of your payment model or your business model is very similar to what pharmaceutical companies are now doing, which are OBAs or outcomes-based agreements, where it's almost like it's a risk sharing. So you're not actually getting paid until, like you said, milestones are being achieved. And that's actually a really innovative way. And I'm sure that it's really been embraced by, the third-party payers. So in terms of people coming in, I'm just curious as well, too, about maintaining standardization and appropriate quality assurance with the people that you hire. What are sort of the protocols and methodologies that you're using for consistent user experience with the dietitians?
Sure. So each dietitian has to take what's called the Lifestyle Coach training course, which is a CDC requirement. So it's an 8-hour course that basically teaches them how to facilitate a group class for the diabetes prevention program. And so that's a national standard. The CDC also manages the diabetes prevention program manual that's made available to all 1,600 organizations. And so in that manual, you have to do things like you have to follow a CDC approved curriculum. So we use I believe it's called the Prevent T2 curriculum, where the CDC is literally giving you the content for each class. And so we've taken that content and turned it into PowerPoint slides. And so this is not like we're picking random dietitians and they're just saying whatever they want, right? This is an evidence-based program, and it gets all the way back to Medicare spent $175 million about 20 years ago, where they enrolled 3,000 people with prediabetes, and they had 3 arms to this trial. There was a placebo arm, a metformin arm, and a lifestyle intervention. And they found that the lifestyle intervention was more effective than metformin in preventing type 2 diabetes. The lifestyle group reduced their risk by 58%. And then people over the age of 60, they reduced their risk by 71%. So that was published in the New England Journal of Medicine. And they've actually followed these patients 20 years later. They're still following them. And still the lifestyle group has lower rates of diabetes. And so one of the reasons why payers love this program is that it is an evidence-based program that's endorsed by Medicare, endorsed by the CDC, endorsed by the AMA. And now they're turning to companies like Fruit Street to say, what's a more convenient way to deliver an evidence-based program? But it is a very standardized curriculum.
Beautiful. Really, really interesting. One thing that always ends up coming up as a question is manpower always ends up becoming the bit of the wild card, and having the appropriate number, especially because, again, services is not like algorithms or computers or robotics, where you can easily scale. So with all of that in mind, if this kind of business model continues to flourish and thrive and build, is there any consideration of replacing some components of what you're doing real time as in a dietitian service with something that might be a little bit more computerized, either through a chat bot or some other mechanism to truly scale?
Yeah, we have gotten that question quite a lot. I think the first thing I would say there is that the reason why it is scalable, even with humans, is because of the power of group visits. So if we were doing one-on-one counseling between a dietitian and a patient, it would be impossible to scale. But when you're doing one dietitian and 30 patients, it's actually very scalable, because one dietitian might be working with 20 classes at a time. So if you have one dietitian, they could be working with 600 people at a time. So if you have 1,000 dietitians, you're talking about 600,000 people that you're able to scale to. And so there was actually a book that someone wrote called The Community Cure that's all about the power of using group visits to address chronic diseases. And the groups build this powerful sense of community that helps to drive behavior change, but it's also a cheaper healthcare intervention because, again, it's one dietitian to 30 people. It would cost 30 times as much to do that one-on-one, right? So it's literally 30 times cheaper. But I do think there's a role for an asynchronous component. It could be a chat bot. It could be that the participant is sent content throughout the week, for example, or there's maybe some asynchronous recordings of videos. So I think that the even more powerful combination would be not just synchronous video conferencing, but synchronous plus asynchronous communication, where maybe there's a chat bot, or maybe you take a picture of your food and it gives you some feedback on the meal instantaneously. So we're working towards that combination of asynchronous and synchronous, but I think we'll never get away from having actual human interaction with the dietitians because people like that human interaction with this program.
Today is such a confusing time around weight loss. You have all kinds of scientific and non-scientific gurus and talking about everything from endocrinology to hormones to various methodologies of weight loss. How do you untangle some of the non-scientific with the scientific and getting people on the same bandwagon, since there are so many variances on how people actually lose weight?
Yeah, so I think that gets back to the CDC's curriculum, where it is an evidence-based program that has been proven to be successful. Even some of my own physician investors get tied up with things like, should we do the ketogenic diet? Should we do, eat more meat? Should we eat more plants? But if you really just look at the scientific evidence, there's a lot of things that really are very clear. We know things like having 5 to 6 servings of fruits and vegetables per day is a good idea. The average American has 1 to 2. Getting 150 minutes of moderate physical activity per week is one of the recommendations of this program. Not very controversial. Reducing our stress is important. Sleeping more is important. Social connections are important. So we actually don't get into a very specific diet. There's people that sign up for the diabetes prevention program that can have many different diets. Some could be plant-based, some could be Mediterranean, but we focus on things like the plate method, where you have some of your plate being lean protein, and then you have vegetables and that kind of thing. And so, I mean, there's also people that sign up for this program that are still drinking soda 3 times a day, and obviously water would be healthier. And so by making just these simple changes, it can be very powerful without even getting into things like ketogenic diet versus plant-based versus this. Even just things like that are simple as eating your fruits and vegetables, exercising, reducing stress, sleeping more, getting social connections, cooking, get people so far. And I feel like in the dietary world, we get so caught up with these fad diets rather than just these common sense approaches. And I feel like the diabetes prevention program is very focused on just a common sense approach.
You were mentioning something really important and really pivotal, which is getting people to make the first right logical step, which is just to make that move of enrolling in the program. And then everything kind of falls into place. As the old adage goes, is that 80% is just showing up. So we as humans always go into places of confirmational bias, doing things that feel automatic, that are easy. Our brains are lazy, our bodies are lazy. We don't like to expend a lot of extra energy rethinking things, redoing things, and getting into stuff that feels not easy and not normal. So anytime we sort of change our habit stacks, what sort of psychological interventions, reminders, we call those dopamine drips on, reminder emails or notifications to try to prompt people over a certain cadence to try to prompt them into some of this behavioral change?
One of the techniques that the dietitians use is called motivational interviewing, where they're not necessarily telling people what to eat, but they're asking the groups open-ended questions about how they think they could solve their own problems. So they might pose a question to the group of, how do you think you could increase exercise? Or what do you think are some healthier alternatives to this food choice? And the groups actually learn from each other. And by asking these types of open-ended questions, it really gets people solving their own problems that in a way that's personal to them. I mean, I could tell you to eat, apples all day, but if you don't like apples, you're not going to eat apples, right? So part of the technique of motivational interviewing is getting people to think about how to solve their own problems. But aside from that, in terms of these kind of digital reminders and that kind of thing, there's push notifications when a dietitian writes a comment on your food log. It's almost like an Instagram style food log. So you'll get feedback from the dietitian in the form of push notifications. We're working on a new badge system, for example, where you achieve certain goals throughout the week, like you weigh yourself 7 days in a row, or you hit your fruit and vegetable goal 7 days in a row, similar to the badge system you would see in the Fitbit app and that kind of thing. But I think ultimately it's about making improvements to your health. For example, people often sign up because they want a free Fitbit or because their employer is giving them a cash incentive to sign up. But and that can get them in the door. But ultimately, I think the reason why they continue participating is that they've participated for a couple of weeks and they're like, oh my God, I've lost 4 pounds and I actually feel better. And so I think that ultimately the reward has to be health. Otherwise, no one's going to do this over a 5 and 10-year period. But I think cash incentives, notifications can be a good way to kind of get people motivated initially.
And on that point about cash incentives and motivation, you hear a lot about these new loyalty programs, especially with third-party payers, insurance companies giving rewards, extra health benefits. Is that something that's eventually going to be embedded into the system as well?
We actually have some already. So when everyone signs up, they get a scale when they sign up. And then after 2 classes, that's when they earn the Fitbit. But we have other employers where after they're in the program and you hit 6 classes, you get a $400 health savings account contribution. And so many of the benefits teams at these employers are including that into the program design, because it makes sense, right? If someone loses 5 or 10% of their weight, their healthcare costs are going to go down in the long run, and that's good for the employee, but it's also good for the self-insured employer or health plan.
There's a lot of pharmaceutical companies that we work with, and probably people listening to this as well. And they're always looking for program supports for their patient support programs, other add-ons, additions, things. And again, obviously payers and insurance companies are looking for these systems. How can pharmaceutical companies partner with a company like Fruit Street Health to help them with their patient support programs?
Yeah, it's an interesting question. I've seen some pharmaceutical companies invest into companies like Fruit Street, which I would just put under the digital therapeutic category. I mean, maybe it's more of telemedicine, but there have been pharmaceutical companies to invest in this space. We haven't done that to date, but one thing we've discussed with them in the past is, for example, if someone has a weight loss drug, let's say, I mean, if they just take that drug and they don't do anything to change their diet and lifestyle, they're not going to lose weight, despite the fact that they're taking that drug. I also think there's certain medications that one of the side effects is weight gain. And so we've thought about, could we offer this service as well? I think it just becomes a question of how do you actually do that from the patient side of things? I mean, could it be that a physician prescribes a certain medication and then they also recommend a digital health program alongside of it? I think that's where it gets difficult. How do you actually get both the drug and the digital health solution into the hands of the patient? And maybe that's through the physician. So we haven't done much in that area, but we've had some discussions that are interesting.
It is an interesting conversation. And of course, healthcare is extremely complex, convoluted, complex system, right? So there's many different ways to skin a cat. Also kind of curious, you have a cohort of, patients pre-diabetic, a lot of interesting things to study them over time. What about pharmaceutical companies partnering for things like patient advisory boards, focus groups, or potentially even as candidates for clinical trials?
Yeah, no, it's interesting. I mean, we've talked to pharmaceutical companies in the past about using our telemedicine software as a way to run their trials. We actually have a few trials being done right now at the Harvard Health System where they've wanted to use this as a tool to track diet and lifestyle in clinical trials, where they want to track what people are eating, for example. Because there's a drug where actually their diet is relevant to the outcomes of the study. So what are people eating? What's their weight? What's their physical activity? What's their sleep? So we have had our software used in a few clinical trials where they found value in being able to track patients. This is not the primary thing that we do, but telemedicine and wearable devices and mobile apps are an interesting tool for pharmaceutical companies that are running trials, is what we've discovered.
There's also this opportunity around data lakes, data aggregation. So obviously, Laurence, Fruit Street Health is compiling data sets. Just curious about where the future of that is in terms of, people leveraging that, accessing it, being able to help with things like population health management and larger scope prevention programs.
Yeah, well, one thing we're doing is we are actually working with the CDC, where we are going to actually have them do an outcome study on our data. So one thing we're exploring is basically giving them access to this data to actually publish something on the outcomes. Even just within the diabetes prevention space, it is a very interesting pool of data because this is one of the largest digital health programs for diabetes prevention out there. And I think it's important that the diabetes prevention industry keeps publishing about its outcomes, whether they're good or bad, because it's how you learn about what works and what doesn't work. In terms of population health, we've worked with some of our health plans where they have actually analyzed things like their claims data, and they've looked at pre and post enrollment into the diabetes prevention program, what happens. And we found things like ER visits go down, other things improve, like things associated with depression, the claims costs, all that kind of stuff. And so often these health plans and employers that we work with will actually look at the effect of this lifestyle change on their overall claims costs. And they tend to find that it really does improve the health of their population and reduce costs. And then the last point would just be that once our data set gets bigger and bigger and bigger, we want to do things like analyze that data set to do profiling and figure out, what makes someone successful. Is it that they're taking 5 pictures of their food a day and they're weighing themselves 3 times and then they're talking to their dietitian? And this is where I wish that my data scientist was on the call, but he's talking about doing machine learning and AI and all that kind of stuff that I don't fully understand. But could you have, let's say, a chatbot or something like that intervene based on what's actually happening, based on what we've learned from the previous 20,000 people that have enrolled? Because that's how we approach the product development. It's looking at how users interact with the program, seeing what works, what doesn't work, and then making changes based on that. So it's almost like you're constantly running a clinical trial and just figuring out how to improve the software.
It's a lovely, interesting way to do benchmarking. And again, like you were saying, is having those interventions at any given time. So, reminding people, like, if you want to get to this, and using your smart, machine learning to do that. We live in a world of frankenfoods. Sugar abounds, flour is everywhere. It's food that's uber, delectable and delicious. And, we're living in a world where it's really hard to be eating properly. Do you feel like the dietitians, the company are kind of swimming in an uphill battle here? Where does it stop? I mean, is this just kind of like putting a patch on a leaking bucket?
Yeah, it's an interesting question. I mean, there's definitely a huge problem of obesity in the country. I mean, 3 out of 4 Americans are overweight or obese. So in many ways, yes, it is a big problem, and Fruit Street's not going to solve it on our own. And I think that's where the CDC comes in, and they now have 1,600 organizations delivering this program, and they've had hundreds of thousands of people enroll. But even the CDC, I would say, is disappointed with the fact that you have 88 million people with prediabetes, and I don't even think there's been 1 million people that have enrolled into a diabetes prevention program. One of the things that we've done to address the food issue is we partnered with a meal kit company called Purple Carrot that does meal delivery at home. But I think, so one of our advisors is Dr. David Katz. He ran the prevention center at Yale. And he said that the thing that's better than telling people what to eat is just feeding them. And so I think it's interesting to think about, could you actually have a diabetes prevention program where you're delivering meals, as well, which we do a little bit with Purple Carrot. But I think ultimately, if you really want to fix obesity and diabetes in the country, it gets back to like a public policy level. I mean, like, why are we subsidizing, corn instead of fruits and vegetables? And that's not the whole problem, but it's things like that. And so we definitely have an issue at the public policy level where we're just subsidizing the wrong things. But I think that, as healthcare professionals, we have to try. This is our job as healthcare professionals, is to address chronic diseases. And I think that by collaborating with the CDC and having thousands of diabetes prevention programs all across the country, both in person and digital, I think that the CDC and these programs will make an impact, but we still need to change public policy as well as it relates to our food supply.
Yeah, it's huge. I mean, what you're really talking about here, Laurence, is at the end of the day, you're talking about a complex system that really requires innovation systems thinking. We can't just be picking apart small silos and hoping that's going to fix the bigger problem. So there's a lot of legs to it. I think it's a very courageous move. I love the fact that you're making some small imprint marks on here, and super excited to see. So what is going to be next for Fruit Street Health? What's in the books?
Yeah, so now we're expanding into a broader suite of telemedicine services. It started out as a diabetes prevention program, but now we're getting into virtual primary care. So imagine if you had a doctor who was a primary care physician that only worked for Fruit Street. We're actually now calling it Fruit Street Clinic, this new product, but they worked full-time as a telemedicine provider. Some people are calling this the rise of the virtualists. So doctors that are only virtual. And they took care of 2,000 patients alongside a nurse, a care coordinator, and a health coach. And that physician could do things like text chatting with the person, video chatting with the patient as well, writing prescriptions, ordering labs, doing annual wellness visits, where they actually advise the patient about what chronic disease management programs might be right for them. So maybe they discover through that annual wellness visit that you're pre-diabetic, and so you need to enroll into the diabetes prevention program. So we're having that virtual primary care as the center of everything, but then around it, we're building chronic disease management programs around this concept of using group visits for chronic diseases. So we started out with group visits for diabetes prevention, but we're building a program for type 2 diabetes, for hypertension, for smoking cessation, and there's several others that you could build. But I think that 90% of primary care can actually be done online. And I think many physicians learned that for the first time during the pandemic. But the ability to talk to a doctor and get a prescription, which is basically what a lot of the big telemedicine companies do, that's not how you improve health. You actually need to change diet and lifestyle, change patients' behaviors. And that's where this kind of wrapper layer of the chronic disease management programs come in. Because what the payers are looking for is a one-stop solution. They don't want their employees and health plan members to log into 36 different portals. They want a comprehensive one-stop solution that will address many different chronic diseases. So that's kind of the direction that we're headed to.
Laurence, so exciting. And I just think it's a brilliant idea. I love the way you took this methodical step-by-step approach, leveraging solutions, projects, programs, things that are already set up, and just kind of leverage what was already there to make something really powerful. So really, really great. For those of you who are listening to the show today, we encourage you to reach out to Laurence, pharmaceutical company or otherwise, if you're interested in starting a program, leveraging it, determining how you might be able to partner or work with them, patient support programs, clinical trials, et cetera. Laurence is the guy to speak to. We will be leaving his contact information in the show notes, so please take a look for those. We also encourage you to check out impetusdigital.com. If you enjoyed this conversation and you're interested in doing some of these prevention programs for chronic diseases, working with virtualists and expanding the program for both synchronous and asynchronous continuous touch points over time, building curriculums, this is exactly what Impetus does through our online insight platform. We allow these to happen in a consistent manner. So please check that out if you're interested. Please like and subscribe to our channel. We'd really appreciate if you could leave us a podcast review so other people can find our information as well. We want to thank everybody for your time today, And Laurence, absolutely enjoyed our conversation. Wishing you all a great day ahead.